Fecal incontinence, also known as accidental bowel leakage, is a devastating condition with significant social, psychological, and self-perception effects. Fecal incontinence is the unintentional or unknowing loss of stool. Fecal urgency is the sudden urge to defecate that often comes without appropriate warning and can often lead to fecal incontinence. Symptoms of fecal incontinence and anal incontinence can range from unintentional passage of gas or liquid stool to unintentional passage of well-formed stool. Gas and liquid stool are the most difficult to control, whereas well-formed stool is typically the easiest to control. Fecal incontinence is most often caused by damage to the pelvic floor muscles, especially the anal sphincter muscles, and also their nerves. Most often this occurs during vaginal delivery, whether by a vaginal tear or during an episiotomy. The other more unusual reason why fecal incontinence can occur is if a woman has a rectovaginal fistula, which is an abnormal communication between the rectum and the vaginal canal. There are several treatment options for fecal incontinence and fecal urgency. These begin with behavioral modifications to develop more well-formed and bulkier stool that is thereby easier to control. Also, pelvic floor physical therapy can be provided to rehabilitate the pelvic floor muscles and also retrain the anal sphincter sensation and control. Surgical treatments include performing an anal sphincter repair or plication, which can be considered if a woman is also undergoing pelvic reconstructive surgery for prolapse. Alternatively, sacral neuromodulation is very effective for the control and improvement of fecal incontinence. Sacral neuromodulation is a procedure performed in the operating room whereby a small lead is placed alongside the pelvic nerve and connected to a pacemaker-like device that's implanted above the buttock. Fecal incontinence is often embarrassing and tremendously bothersome, and also causes troubling psychological, emotional, and sexual effects. We encourage all women suffering from these symptoms to discuss these with your physician and consider referral to a urogynecologist so we can discuss different treatment options available for you.